Hi, my name's Polly Swingle, and I am a physical therapist and also one of the owners of the Recovery Project. And today we are going to talk about aging, geriatrics, and the importance of exercise. So before I get started, want to remind everybody out there to please like us on Facebook, also share with all of your friends on Facebook. We really appreciate it. So let's get started and talk a little bit about what happens to our bodies as we age. There is so much evidence and research out there on what happens to our muscular system, our nervous system, our bones as we age. So let me tell you a little bit about that. So aging really begins in the third decade. So in your 30s is when we start seeing the effects of aging in all of the systems of our body. For example, between the age of 25 and 30, the average man starts having a decline within their resting heart rate by about 5 to 10% per decade. So what that means is that if you have a decline in your resting heart rate, your heart is not working as efficiently. Your heart is not able to pump the amount of volume of blood that's needed for your cardiovascular system. Because of that, if you do not try to keep yourself healthy, then you can develop high blood pressure. From there, you can develop coronary artery disease. Also, one of the statistics out there that in the fourth decade is when we typically see American people start gaining 3 to 4 pounds per year. And as we know, hopefully we all know, is that if you do start gaining weight, typically tends to be not muscle in the fourth decade, tends to be fat, that we start moving into some secondary medical problems that could result in cardiovascular disease, diabetes, stroke, and some of the other diseases that we see with aging. One of the things I wanted to share with everybody is a study that I recently read that was originally done in 1966, which probably you're thinking, why would you want to talk about a study done in 1966? But what they did is they looked at 5 healthy individuals that were 20-year-old in 1966. They re-looked at them 30 years later when they were 50. So in 1966, when they originally looked at these 5 healthy individuals in their 20s, what they did is they put them on bed rest for 3 weeks, not doing anything. Then what they did is when they brought them out of bed rest, they looked at their basic vital signs. So they looked at their resting heart rate. They looked at their blood pressure, systolically and diastolically. They looked at their bone density. They looked at the amount of muscle strength that they had in their body. What they found, which isn't a surprise, is that after laying in bed, being sedentary for 3 weeks, that there was a change in the negative side of a diminished of all these vitals that tell us if we're healthy. So their resting heart rate went down, their systolic blood pressure went up, their cholesterol went up, their bone density decreased, and they lost muscle mass in that period of time of 3 weeks. Then they took these 5 individuals and they put them on an 8-week exercise program. After the 8 weeks, they remeasured everything, and what they found is that everybody came back to baseline. And what was even better is they diminished any of those negative health signs from bed rest, and they even improved beyond that and became even healthier with 8 weeks of exercise. They then looked at these same 5 people when they were 50, so 30 years later. And first of all, they tested them. And after 30 years, in their 50s, most of the individuals had higher blood pressure. They lost some muscle mass. They lost some bone density. Some of them had diabetes. Some of them have already been diagnosed with coronary artery disease. They took these 50 people and they did not put them on bed rest. But what they did is they had them participate in a 6-month exercise program, which included 150 minutes of exercise per week that included mostly aerobic training, which was cycling, walking. After 6 months of this training, what they found is that all of the individuals, looking at their blood pressure, their heart rate, their cholesterol level, the amount of muscle that they had in their bodies and bone density, that everybody returned to where they were when they were 20. So they proceeded not just improving at age 50, but returning all the way back to baseline. So the reason why I'm telling you this is a really good example that shows the benefits of exercise as we age. Right now, we do not have that pill of the fountain of youth that we can take that can slow down the aging process, but we do have modalities out there that we can use that can help change aging to our very vital systems in our body. You know, one of the things we at the Recovery Project work with neurologically involved patients. So we do see many patients that have had stroke, which typically is caused from a coronary artery disease process. And with exercise, as I just said, that can reverse all of those type of signs. So the other thing, since we work in the neural field, is that we also see with aging that people will have some neurological changes. We will see a decline in memory, in cognition, in react time, and because of that, people may fall more frequently. There are many, many studies out there as well that there is also a change with the central our Parkinson's population that we see here, and that the benefit of exercise on the neurological system is just as beneficial as the medications out there for Parkinson's disease.
So what types of exercise should we start doing? I'll say at the age of 30. Like what should we be doing early on?
So early on, I would say two things. One is definitely work on the cardiovascular system. So that's doing anything continuously for up to 20 to 30 minutes. So that could be cycling, that could be walking, that could be jogging, that could be swimming. But the important aspect of that is doing it at a moderate intensity. So what that means is that you're not just sitting there reading a book, that you are breathless, that you can feel your heart rate elevate. So working on the cardiovascular system is going to help with your overall health to decrease as you age any heart disease, diabetes, stroke, something in that realm. The other is strength training, because we know through evidence that as we age, we lose strength. We can lose up to 5 to 10% per decade of our strength. So it's crucial that we do strength training. So that's resistive training. Doesn't have to be super heavy weights, but just something that you're adding a little bit of moderate intensity to your muscles as you age. Very important to do strength training of your lower body. And the reason for that is because as we age, there is a relationship with weakness of your lower body, of your legs, with the increase of falling.
So now that we're in our 60s or 70s and we have been kind of sedentary, how do we begin to start moving our bodies?
You can start slow, and it's never too late. I mean, you can even start in your 80s or your 90s to work at aerobically as well as strength training at a moderate intensity. So we always say to start, if you have never exercised, is first, always go have a checkup with your doctor. So you want to just make sure that everything is okay to go. They'll check your blood pressure, they'll do some blood work to make sure you're okay to exercise. Then there's so many different avenues that you can get involved in exercising. You don't always have to come in to see a physical therapist. But if you're having a lot of falls, if you notice that as you exercise, you're really breathless or you're starting to get joint pain, come see a physical therapist and we can design a program for you. If you're having a lot of falls and you're afraid to exercise because you may fall, come see a physical therapist and we can design an appropriate exercise program. But the easiest thing is just starting to walk. What is recommended by the American Heart Association is exercising 150 minutes per week, and that can be broken down to any time frame, any block of time. It could be 10 minutes in the morning, 10 minutes in the evening. So you don't have to do a 60-minute block of time, but the importance of that is doing it at moderate intensity. So you're breathless, you can feel your heart rate increasing. There's an intensity, a difficulty to that activity.
Now, are there different exercises based upon maybe diagnosis? Someone who has maybe have had a stroke or somebody who has Parkinson's, are there different exercising techniques or things that they do differently?
There are, because it depends on, first of all, your abilities as well. For stroke example, one of the things that we always recommend is that typically the cause of a stroke is because of a cardiovascular event. So there is either high blood pressure in the history of a person that has a stroke. So the risk of having a second stroke is like over 70%. So we want to work the cardiovascular system. So aerobic training is crucial for somebody that's had a stroke. What that does is it helps the heart get healthy, but it also helps with circulation so that we can get all of the neuroplasticity happening in the brain to get movement back, to get your coordination back, to get maybe your speech back, memory back that we see in stroke. Now in Parkinson's, cardiovascular is also very important, meaning working aerobically, but we also know with Parkinson's that people have balance problems, so we'll work on balance. We also notice that there's coordination problems, so we'll work on high velocity coordination type activities like boxing. You know, we've talked about that in the past. You know, boxing will work on coordination of right, left, different combinations, but it also adds an intensity to the exercise if you're striking a mitt, if you're striking a bag, or if you're just being cued to throw right, left, jab, punch, whatever that is.
Okay. So as far as, let's say, caregivers, are there certain things that they should encourage, like even at home as far as exercise?
Okay, yes. But my first thing is you got to move. You know, being sedentary, sitting in a chair watching Wheel of Fortune is sedentary. And I just said with that study, so 3 weeks being sedentary, it doesn't mean laying flat, it means not moving. It can be just detrimental to your health. So first of all, you got to keep moving. One of the things that I will say to the people that aren't as active is that every half an hour you need to do something. So for example, every half an hour I want you to stand up and sit down on your chair 20 times in a row. Every half an hour, I want you to walk from your chair into the kitchen and back, so you start there. Or maybe it's walking down the bottom of your driveway and back, and then you build on that, working towards the goal of 150 minutes of movement, exercise, then adding that intensity as you can tolerate that exercise.
Okay. And so what about those that are aging that may be in a wheelchair? What kind of exercises can they do?
Oh, they could do, you know, again, if you're in a wheelchair, maybe you can't move your legs. So there's definitely some things you can do with your arms. You can do strength training with bands in your arms. You can use hand weights. You can use cycles. You can just swing your arms back and forth. Many people that have had a stroke, maybe they're in a chair because one side of their body's not working. But that doesn't mean that you ignore the other side of your body. There's definitely lots of movement and exercises that you can do with the other side. Again, that is a great question that you can go to a physical therapist and they can design a program for you that either you can do independently or that your caregiver can help you do that program. There are many facilities out in the Detroit area. We're one of them that has wellness programs. So you definitely could sign up for a wellness program that you can come in with your caregiver, that it's very minimal cost, and that you can exercise for an hour class with other people maybe that have had a stroke or maybe that have Parkinson's. But there's also other programs in the community. There's YMCAs, there's Silver Sneakers. So there's are things that you can access within the community that you live in.
Okay. And we do have a question, and it's geared towards that. We have a question that states, where can I find out about local exercise classes offered in my community? So
I would say two things is, of course, always check our website, because we have a lot, and that's www.therecoveryproject.net. So absolutely, and our website tells a lot about what we do here as well as in Clinton Township and in our Lansing facility. But I would also start at your community centers. So you could start here in Livonia, for example. Check your YMCA. Check websites for the aging. They will have those. If you're looking in your Parkinson's, the Parkinson's Association of Michigan will have different classes listed. The senior centers in your area as well. So there are a lot of things that are accessible out there that either are free or for very minimal cost.
Right. Now, are there anything that as we age that we really need to know outside of just exercising, just regular exercises? How does exercises help us like mentally?
Well, there is a direct relationship with that. There's a lot of evidence out now on the effects of exercise with your cognition, which includes memory, which includes speech, but also includes judgment and dealing with multitasking and complex type thinking skills. So we know that exercise increases your heart rate, and whenever you increase your heart rate, you have more blood flowing through your body. The blood flows throughout your body into your brain, and we know with that that our brain needs blood to be healthy, and it works on the neuroplasticity of your brain, which neuroplasticity is that we now know that your brain can relearn how to do activities if cells are dying off either from a stroke or from aging. So it's super important to exercise, again, at moderate intensity. But I also want to add to that, it's also important for your cognition to learn something new. So maybe you don't know how to crochet. You know, I'm just learning how to play the guitar. I don't know how to play the guitar, but learning something new challenges your brain, your coordination, doing crossword puzzles, you know, learning to play bridge, whatever that is, also benefits your cognition and your memory.
Right. Well, thank you. Is there anything else that you can add to this? What great information.
I think I would end that it's never too late to start. No matter what your age is, no matter what the situation, if you fell and you broke a hip and you think, I can't, you can. You can start at 60, 70, 80, 90, even 100. It's important to start because it will just change the quality of your life.
Great. Thank you.
Thank
Polly.
you.